Flu deaths surpass COVID-19 for the first time since the pandemic. What's going on? The unexpected twist in the battle of viruses. For the past few years, COVID-19 has been the dominant virus shaping our lives. From lockdowns to vaccines, the world has focused on fighting one major public health threat. But now, for the first time since the pandemic began, something unexpected has happened. Flu deaths have overtaken COVID-19 deaths in the U.S. According to the CDC, nearly 1.7% of all deaths nationwide in late January were due to the flu, surpassing the 1.5% caused by COVID-19. In 22 states, flu deaths have consistently outpaced COVID-19 deaths in 2025. So, what's behind this shift? Is COVID-19 finally becoming less of a threat, or is flu making an aggressive comeback? Let's break down the data, the risks, and what this means for the future of public health. The numbers don't lie. A record-breaking flu season. Health experts have been warning about a severe flu season, but few expected it to be this bad. According to CDC data, 1. The flu hospitalization rate is 3 times higher than that of COVID-19. 2. In states like California, Hawaii, Washington, Oregon, and Wyoming, flu deaths are at least double those from COVID-19. 3. The estimated flu death toll this season ranges between 13,000 and 65,000, already surpassing last year's total flu deaths. Meanwhile, COVID-19 deaths, while still significant, have not seen the massive spikes of previous years. So, why is flu making such a strong comeback? Why is COVID-19 declining? A look at the factors. Just a year or two ago, the thought of flu surpassing COVID-19 in deaths seemed impossible. But this winter, a combination of factors has kept COVID-19 in check. 1. No major new variants. Unlike previous years, there hasn't been a new, highly mutated strain of COVID-19 driving a major surge in cases. 2. More immunity. Millions of Americans have either had COVID-19 or been vaccinated, reducing the virus's ability to cause severe illness. 3. Improved treatments. Hospitals now have better treatments, from antiviral pills to updated booster shots, making COVID-19 less deadly than before. 4. Higher vaccination rates in high-risk groups. Older adults, who are most vulnerable to severe COVID-19, have higher vaccination rates compared to flu shot rates. This doesn't mean COVID-19 is gone, but it does suggest that the virus may be settling into a more predictable seasonal pattern. The flu's big comeback. What's fueling the surge? While COVID-19 has slowed down, the flu has surged to its highest levels since the 2009 swine flu pandemic. Here's why. 1. Lagging flu vaccinations. Flu vaccine rates are down across all age groups, especially in children. 1. Only 45% of kids have received a flu shot this year, down from 58% in 2020. 2. Weakened immunity. With masks, lockdowns, and social distancing over the past few years, many people had limited exposure to the flu. 2. This means their immune systems are less prepared for this year's aggressive flu strains. 3. More contagious flu strains. Some of the flu strains circulating this season are causing more severe symptoms than in previous years. 4. Misinformation and fatigue. Many people who got vaccinated for COVID-19 are skipping the flu shot, believing they don't need it or underestimating the flu's danger. The result? Overcrowded hospitals, a surge in flu-related deaths, and a reminder that influenza is still a serious threat. Should we be worried? What this means for public health? The shift in flu versus COVID-19 deaths is a wake-up call. It shows that even as we move past the worst of the pandemic, other infectious diseases are still a major public health challenge. Here's what health officials are saying. 1. Flu isn't just a bad cold. It can be just as deadly as COVID-19, especially for the elderly, children, and people with weakened immune systems. 2. Vaccination is key. Flu shots remain the best way to prevent severe illness, yet millions are skipping them. 3. COVID-19 is still here. While flu is outpacing COVID-19 in deaths, the virus isn't gone. 3. New variants could emerge, and low booster rates could make future waves worse. The bottom line? Ignoring flu season is a mistake. This year has proven that it can be just as deadly, if not more, than COVID-19. What's next? How to stay protected against flu and COVID-19. With flu activity still high and COVID-19 continuing to circulate, here's what you can do to stay safe. 1. Get vaccinated. If you haven't gotten your flu shot yet, it's not too late. 1. Vaccination can reduce your risk of severe illness by 40 to 60%. 2. Wash your hands regularly. Both flu and COVID-19 spread through touch, so hand hygiene is crucial. 3. Stay home if you're sick. Many flu cases are spreading because people are ignoring symptoms and going to work or school. 4. Consider wearing a mask in crowded places. While not required, masks can still reduce your risk of catching respiratory viruses. 5. Keep an eye on public health updates. If a new COVID-19 variant emerges or flu activity worsens, staying informed can help you make smart health decisions. The flu isn't going away anytime soon, and COVID-19 is still lurking. The best way to stay safe? Take both seriously and take action to protect yourself. Stay informed. Stay healthy. For the first time in years, flu has overtaken COVID-19 in deaths, proving that it's still a serious health threat. While COVID-19 has slowed down, flu is filling the gap, and the consequences are real. What do you think about this shift? Are you surprised flu is more deadly than COVID-19 right now? Drop a comment, hit that like button, and don't forget to share and subscribe for more updates on trending health stories.